This is The Change Physician, episode 190. Welcome back to The Change Physician. I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, here today to discuss a bit about Kate Othus and HPA, or Health Professionals Alliance. This actually relates to our previous 3 episodes. We had an amazing conversation regarding not just her story, but some of the things she's doing within Health Professionals Alliance, and in discussing acquisitions and consolidations, why they're happening, the pros and cons there. And we just wanted to talk a little bit about our thoughts or takeaways. And did you want to start, Kevin, or you want me to go into it?
You can start.
Okay. Well, first of all, I found, I discovered Kate through a mutual friend who's been doing a lot of work with HPA, and kind of piqued my interest. And actually my friend was like, the way you think and the podcast you're doing, you might want to discuss a little bit more with Kate and see, if it's a good fit. And definitely a good fit. She's all about trying to empower physicians and trying to ethically, morally do the right thing, trying to help the healthcare system, which we all know has been a huge challenge in this country. Despite all the money put into this medical system, it definitely does not resonate, or it's not in alignment with where we rank in this world. And so I was curious as to kind of what led her into this direction. And it's interesting because her mother was in the medical field as a nurse, and she talks a little bit about that and the upbringing, and father was a farmer, and just some of the little turns that she took and decided to get into more of the business aspect of medicine, and how she's been trying to help physicians and even getting into consulting. So I really like the fact that she discussed how the transition from her employee status to a independent business owner or consultant, and that mind shift that can go on. I think it probably helps more so even helping on the intangible aspect to physicians who are either trying to create that or maintain that. So that's the one thing in the first episode that that was the thing that stood out to me. Any thoughts in that first episode?
Yeah. Just other than her background, I think I wish we had a little bit more time to just kind of talk about the path to entrepreneurship, because that's something that's very interesting to me. Because we've had a number of entrepreneurs on, and entrepreneurs, there's something that they're doing differently. And as soon as she said, she's like, because we were asking like, what was that kind of entrepreneurial transition? She's like, some people have asked me that, and they just, at some point you have to just do it. That made me think of Naveen Goyal, who we had come on with Loud Capital. And from a personal standpoint, I want more details. So it made me think we need to find someone who is an entrepreneur, who's like no entrepreneurial DNA at all, like who understands that transition, because it's just amazing, these people who make this step. And they all say it's challenging, and it's hard, but the actual transition, they just do it. They somehow navigate it, and just based on what her company is doing and the growth stages that they're in, they're doing it really, really well. So I was impressed by that, but I always want to know more on the kind of entrepreneurial duty or journey.
Yeah, there's a lot of comments that are made when it comes to people that are successful or entrepreneurs, and you hear these comments or quotes about, if you just do what you love, you'll be happy. And there is a certain element of truth to that, but then there's that part. It's like, you got to be willing to do the things that aren't like fun, or they're mundane, or they're challenging, because I think there's just a lot of people that turn away, they veer away from that discomfort.
Well, and then there's so much more than that. Doing whatever you love, ultimately still not going to pay the bills, because there's a system behind it. So it's being able to pair doing what you love that delivers value to others that they are willing to pay for, and then making sure that you get paid doing it, right? So there's some finesse there that I think can be very challenging for people who were not in that kind of role. And then, man, we should just have her back on for just a really deep dive in, because I'd be awesome. She talked about really briefly pivoting
Mhm.
And when you're an early stage company and early stage entrepreneur, that ability to pivot is so key. And people may be like, what does that mean? Well, not getting fixated on the idea that you're having, which is really easy to do, I think, particularly in medicine, because we're very data driven and we tend to want all this evidence before we change. But you can't do that as an entrepreneur. This is real time
On
evidence
the
coming
fly.
in, and you have to be able to shift and turn on it. So I guess for the first episode, I would just say there was some really great stuff in there and made me want to have more and more conversations with her.
Yeah, I think we should unpack more later. On the second episode, we talked more about Health Professionals Alliance and what they do to help physicians remain autonomous or become autonomous. And I think it's interesting, when you think about talking about a lot of things you don't want to deal with or do, you may love seeing patients, but you got all these business intricacies that are required to maintain the ability to see your patients and, like you said, make money. So you have to have a system in place that is going to lend itself to making money or be profitable enough to keep the doors open. So everything from credentialing to, just even like marketing or there's all these little pieces. Purchasing, billing,
Yeah.
contracting, like all these things are so important, but they're headaches. And, for most, if you had a choice between having to do that or not, most of us say we don't want to have to do that if we didn't have to. Cash practices obviously can have a few headaches erased, like having to worry about submitting a billing code to an insurance company. So that's some headaches. But if you have the support in a system and there's a menu of things that you can go on at different levels based on the size of your practice or what you need or where you're deficient in, I really like the idea of not just that, but them building this community of people that they're leveraging for potentially even creating more affordable healthcare. I don't know if it's ever going to be perfectly affordable, but allowing options to make things more affordable, especially for a solo practitioner.
Yeah, so we went a little bit more into the whole HPA model, the Health Professionals Alliance, which, to kind of recap in case you guys forgot, was they build it as a membership model where physicians join, and then they provide this infrastructure to those practices. The couple of things that I liked is she emphasized that 80% of the company is owned by the members. So the members that have actually purchased an equity share, that's a big deal. Because people, well, sure, you're an owner in the company, but the other part is it gives you a lot better sense of control. And if the group members are 80%, that to me is very, very encouraging, because if they're actually going to take it public, which they want to be doing, you want to make sure, like we talked on the next episode about private equity. So you want to make sure you can protect yourself as best you can against private equity and who maybe want to just come in and buy you after they're done. So I really, really like that. And the other thing that I thought was really kind of interesting is the depth of how involved you can be. You can be a kind of, it seemed very flexible on where you are and the services that they deliver. So they have that software solution,
DataDx.
DataDx, that can provide you some really useful numbers and metrics, which are key. And then being able to kind of go up those different levels into full membership. And if you needed, this corporate structure almost where you need a CFO, maybe you're big enough, your revenue is good enough that you actually need some really, really good accounting and really need to have some in-depth there, or you're planning on getting there. That's the other thing that she kind of emphasized is being able to think forward and not just this reactive model where you're just trying to keep the doors open. I mean, granted, that's the first goal, and most people don't want to change until there's an actual problem. But if you can get with an organization that's actually so much forward thinking, really impressive. And the other part, which I mentioned to her afterwards, is the fact that she mentioned ethics. This is, yes, as a business, healthcare is a business. Don't let anybody else pretend that otherwise. It totally is. And it's just going to be how it is. So at least be cognizant and aware, like flat out recognize that there's a revenue model in here, but do it ethically. and not in this rapacious way. And the fact that you're now going in and you're joining a group that already at least is thinking that and using those terms is a big deal to me. Like that was huge. So I liked it. And I think it provides a good, we've talked about direct primary care, which is really ideal in my mind for primary care physicians of any type that are perhaps a little bit willing to take that entrepreneurial step. But on the specialist side, it's a totally different beast. Most direct care models don't work. You've made it work for anesthesia, but that's not everybody can do that. So I like that this is perhaps a path for people who maybe are just starting out, or maybe there's a small group or interested and are trying to navigate these shark-fested waters, whether it's the health system or it's these groups that either private equity already owns or are in the act of buying. We need more options, and I think this is a great option for people out there.
Yeah, I think creating you think these big groups, they're so powerful with what they can do, leveraging and negotiating all this. I think it's kind of cool to be able to create an entity that's, like you said, 80% physician owned, where the power is within more of the physicians versus like just this people out there that aren't doing patient care. So I love that. And on the third episode, which ties into everything, is why acquisitions and consolidations are happening in healthcare. I think it reminds us of, especially young physicians coming into the world of private practice, and they're trying to figure out contracts and understanding if there's private equity involved. Those are the key words she kind of used, that people are having more awareness. It's more front of mind. Kind of like, front of mind with just, you're just talking about, is this, something that is ethical? I think you need to have certain words in front of mind, and that kind of drives sometimes your behavior and understanding. So private equity and understanding what you're walking into or potentially walking into is a critical piece for young physicians to know. And, of course, we talked about examples of how things can go really bad for especially if the people exiting benefit and reap the benefits, and then everyone else is maybe surprised that things they've not turned out so well. So
yeah, and I think I've seen more bad stories than good stories, and that's maybe because I just don't know any of the old retiring people who are making the big bucks and then exiting. But because I know we have non-physicians who listen to this all the time. This is a big deal, this private equity thing. And if you're not aware of it, I would literally Google private equity in medicine. It is absolutely terrifying. And because they're basically these, you just kind of think about it. They're like imagine Wall Street going in and buying a practice, and what they're doing is they're looking at through the rapacious eye of how much profit can we extract as quickly as possible. So quite literally, these groups have gone in and they've changed billing practices in ways that are unethical, and which the physician then is on the line for, because they're the ones who can get busted for Medicare fraud. You got if it's a procedural based practice, the procedures go up. So and we like, how do you know this? Well, you don't even know half the time unless you get the billing sheet later on. The name of the practice, the name of the clinic can stay the same on the outside. If you notice turnover of people that were there for many years and all of a sudden they're gone, if I was a patient, I would start asking that. The other thing I would ask is if there's a change in behavior. And what I mean by that is if maybe you're going in you see dermatology once a year for a skin screening, and every year they've been kind of watching you and they've been very, very conservative. But all of a sudden you're going in now, and now they're wanting to biopsy everything, which they never used to do. That to me would be a concern, is if there's a change in the behavior that they've established and there's no good explanation for it. Because they are quite literally going into these groups. Derm was a big one. There was apparently fights at some of the larger derm association gatherings because some of the dermatologists actually studied the effects of private equity, and a lot of the bigwigs in the American Dermatologic, whatever the academy is called, were pissed because they were involved in these things, and these people went in data driven and showed like private equity comes in, boom, look at overutilization, how much is going up. But there's not just derm. They're going into, they're all the profit driven ones. Anything with the surgery center, spine, pain is getting bought out. It just is absolutely terrifying and atrocious. So yeah. That was one. And we could do a whole nother episode on that one because there's so many things to concern up. And I'm always concerned about, like, my wife and I are physicians, and every time almost every time I'm basically saying, I don't know what people who didn't go to medical school or don't have a healthcare background, I don't know how they navigate this mess. It's freaking terrifying. Terrifying. So hopefully I don't end that on and scare people, but be very concerned, be very vigilant, watch those behavioral changes, know who owns the practices that you're going to. Oh, so disturbing.
I just wrote a title for an episode. It was like, private equity is public enemy number one.
and here's the thing. Some people will say no.
Public health enemy number one.
Yeah, and people say no. And I saw, oh my God, some propaganda. Like it's actually even a lawyer. They have their own marketing firms, and they're seeding little like blog posts and stuff on magazines about how private equity is good, and people are talking bad about it, but we actually make it better. And because it's all capitalistic, the market drives it. And it's like, dude, healthcare is not like a free, it's a regulated market. This does not conform to these capitalist ideas of supply and demand. And we have also this knowledge asymmetry. So it's ripe for abuse. And so that whole idea that somehow the market is going to decide stuff doesn't work. They're private equity and vulture capitalists is basically, man, they just, God, yeah. I'm sure there's some good ones out there, but just terrifying.
Yeah, I'm private equity is a patient inequity, or I don't know. There's all these. I mean, there's some bad things that happen.
And particularly when you look at healthcare. So we're going way off the deep dive here.
Yeah,
but you're looking at healthcare, and in healthcare, in the current model that we have, what gets reimbursed is things that are done to people. And if that's the incentive, and then you get private equity that is really involved with trying to amplify that incentive, that's what you get. But over and over and over again, what we see when it comes to health, not healthcare or sick care, is the fact that less intervention is better. Proactive strategies are better than reactive strategies. Health, wellness, and we've talked about this multiple times on movement, education, stress reduction, sleep strategies, proper nutrition, all that stuff, which doesn't get paid for at all in healthcare. That's where the health is. It's like, it's just a nightmare. We're just emphasizing and bringing in people that actually make the problems that we already have worse.
Yep. I couldn't agree more. I think, I don't know how to like flip that into something positive, but this is the reality of our system, and we're just trying to bring awareness, whether you're a patient or a clinician, especially a new clinician that's not really thinking in these terms yet. I think we sense some stuff, but I don't think it really becomes clear until you're out there in private practice, unless you've been a patient and recognize the inadequacies and problems with that. But any way you want to sum this up to take us out, or?
No, other than there was a little rant at the end, but and I think what the rant kind of brings in the fact is we need options. And what with HPA and Kate Othus and the work that she's doing with this basically startup that is growing really fast, is it's providing options in a world where there's lots of sharks, and so I've loved it, and I think it was great, and I really encourage people to listen to the 3 episodes that we have, and I'll leave it at that.
Sounds good. Okay. Well, if y'all don't know what the Change Physician is all about and you just ran into us, go to thechangephysician.com. And of course, you check out our podcast, check all the social media outlets, and we'd love to see you there. And until next time, take care.
Stay well, folks.